Thank you, Governor. Good afternoon, everyone. Thank you for joining us today. I want to join with the Governor in expressing our appreciation and trust of you as Rhode Islanders in taking this information and implementing it, complying with the rules going forward in a way that will allow us to continue in the path that we're going. As the Director of Health and as a physician and an adult and pediatric infectious disease doctor, I've wanted to make sure that you have the science and the information so that you have an understanding of why we are saying it's important to keep your network small. It's important to be able to stay 6 feet apart from people who are not from your own household. It's important to be able to wear some form of cloth face covering, all of which is to stop the virus from spreading, because you all have learned the virus spreads most easily when you're in close distance to each other, in crowds, and not washing your hands and spreading illness, whether or not you may have symptoms. So we are confident that you will be able to follow this in a way that allows us to continue to turn the dial slowly without seeing as many changes in the cases or in the data. So let's jump into the data. We have 325 new COVID-19 cases to announce today. There are 318 people currently hospitalized. Of those people, 82 are currently in the intensive care unit in the hospital, and 56 of those 82 people in the ICU are on ventilators. We are very sad to report that we have 18 new COVID-19 associated fatalities. These people ranged from being in their 60s to being older than 100 years old. Of these people who have passed away, 14 lived in long-term care facilities. Sadly, 2 of these people were residents at the Rhode Island Veterans Home. Both of these residents at the Vets Home were in their 70s and had underlying health issues, 2 of the unfortunate risks that lead to bad outcomes with COVID-19. The administrators at the Vets Home and the Rhode Island National Guard, along with the Rhode Island Department of Health, all have taken a very comprehensive approach to responding to the cases that have been identified there as a result of aggressive testing of residents and staff. The same comprehensive and aggressive approach that I've shared with you that we're doing across all of our nursing homes and aim to do with all congregate care settings. Those steps have included cohorting of patients, bringing the patients who have COVID-19 into one area and the patients who don't into another area. Aggressive symptom monitoring, so making sure that any staff who enter and during their shift are constantly checked for symptoms so that they can leave if symptoms develop, as well as making sure that masking occurs throughout and there is regular, thorough environmental cleaning. But sadly, as we're seeing in other nursing home facilities, in spite of these aggressive and comprehensive approaches, these 2 people in the Vets Home were lost. I want to add that while we honor and remember the veterans from the Vets Home, there are veterans who live at and get care at other long-term care facilities throughout Rhode Island. We want to be sure to recognize and honor all veterans in the state and thank all the facilities that are providing them with the accommodations and care in Rhode Island that they deserve. This certainly has been a challenging time for our long-term care facility community. The numbers change day by day, but around 70% of our fatalities have been associated with long-term care facilities. A lot of people have asked us questions because they've compared that figure to the percentage in other states of fatalities that have been associated with long-term care facilities. I want to add one bit of context so that we can look at the full picture as well. Rhode Island's overall fatality rate for COVID-19 associated deaths is actually a little lower than the rates in some of our neighboring states like New York, Massachusetts, and Connecticut. People who live in congregate care settings in all these states and in Rhode Island are at an elevated risk for negative outcomes, as we've discussed. But the fact that Rhode Island has a lower overall fatality rate than some of our neighboring states can make it such that the proportion of our fatalities that are in congregate settings seem a little bit higher, relatively speaking. We have a lower number overall and more people in nursing homes of an older age, and so that can contribute to why that 70% of fatalities associated with long-term care facilities is occurring in Rhode Island. But as I've said in the past, Rhode Island has a population with many beloved older adults. And to share this context, I want to reiterate that the challenges faced by congregate settings and more vulnerable populations in Rhode Island are similar to the challenges in other states across the country. Each time even just one person passes away, it matters. They're more than just a number, they're a human being that we all care about. I also want to repeat that the staff at nursing homes and the administrators in Rhode Island are enormously committed to the health and safety of their residents. They are those residents' second family members. Making a home for these residents is sacred work. They're residents, not just patients, and it's something that staff and administrators take very seriously. We are working with them to support residents and support families during this enormously challenging time.